Equine Pastern Dermatitis, EPD, by Rachel Winker. What is equine pastern dermatitis? It's a skin reaction of the lower legs, mainly the pasterns, that is caused by a variety of conditions. It affects all breeds of horses. It affects males and females equally, but adults are more likely to get it than foals. It's most common in draft horses, and it most often affects the back of the rear pasterns, but can affect the front pasterns and, if not treated, can spread up and around the leg. The risk factors. Long feathering, hence drafts are more likely to get it because of all the long feathering they have that traps the moisture. Non-pigmented skin on pasterns. Perpetually wet or muddy pasture or unsanitary stable conditions. Skin trauma, and also some breeds are predisposed to it. Causes. It has quite a few. Allergies, either to plants or bacteria in wet pasture or wet or chemically treated bedding. Photosensitization. Coreoptic mange, which is skin mites, also very common in drafts. Infection, either bacterial or fungal. Or pastern leukocytoclastic vasculitis, which is similar to photosensitization, but unlike photosensitization, it is present before the sensitive parts are exposed to UV light. Clinical signs. Initially, it'll be edema, skin reddening, and scaling, and then quickly progresses to painful oozing, bleeding lesions and ulceration, which then produces lameness, hair matting, and crusting. And if it's still not treated at that stage, it can progress to skin thickening and fissures from the constant movement and flexion of the joints. So the mild form goes by a few different names: scratches, mud fever, mud rash. This is the most common form, and it's primarily characterized by hair loss, dry scaling, crusting, and also may or may not be itchy and or painful to the horse. The next form that it can rapidly progress to is the exudate form, and this often goes by grease heel or dew poisoning. This is the more complicated form, and it's primarily characterized by skin reddening, skin erosion, more crusting, and blistering, and oozing, foul-smelling lesions. The worst form is the chronic proliferative form, also known as grapes. This is the most severe form, and it's common in draft breeds. It is characterized by granulation tissue, skin thickening, hyperkeratosis, hard, leathery skin, lichenification, and sequelae for this one are fissures from the skin hardening or skin thickening and constant movement, and also warts and benign tumors. How is it diagnosed? The focus is on identifying the underlying cause of the condition. The vet will ask for a detailed history of two different things: the condition itself, the month of onset and age of the horse at onset, if it's seasonal or pruritic, itchy, what meds or topical preparations or home remedies have been used and their effect. Also ask about the horse's environment: bedding, pasture, sand, insect burden, moisture, and if any other animals or humans are affected. If so, it could indicate a zoonotic source. The vet can sometimes determine the cause just from the owner's description of the history and environment, but other times further tests are required to pin down the exact cause. For example, biopsy, allergy testing, blood work, etc. However, the location of affected area can sometimes indicate what the cause is. For example, if the cause is photosensitization, then it will most likely be mainly the non-pigmented areas or those that get the most sun that are affected. Treatment. There's a few different categories for this. There's environmental, there's clinical, and then there's a whole alternative treatment section. So the environmental changes that need to be made is stable and clean, dry conditions. Don't turn horses out until the dew has dried or when it's wet and muddy. If allergies are suspected, try using a different type of bedding and attempt to identify and remove the offending allergen from whatever environment it may be, whether it be the stable, the pasture, or somewhere else. Keep long hair or feathering on the fetlocks, clipped shorter, not too short, or it could actually make the affected area more sensitive and vulnerable, but short enough that it won't hold on to too much moisture. Want to keep the legs dry. And if you must work a horse and there are lesions in the saddle area, put a clean towel between the lesions and saddle pad to prevent the lesions from becoming contaminated by whatever is on the saddle pad. Clinical treatments for equine Pastern dermatitis are to wash sweat and mud off after working with an antiseptic shampoo before it can dry. Allergies may need steroid treatment depending on how severe they are. If the horse is photosensitive, stable them during the brightest part of the day, or if that's not possible, at least cover them with a sheet, mask, and leg wraps. There are various preparations for lesions and parasites. Remember the chorioptic mange, those skin mites, in which case you'd want internal or topical deworming, depending on the source. And for various types of infections, you want antibacterials, antifungals, antiseptics, and if you're using antibiotics, sometimes both topical and a course of internal antibiotics is required. You want to clean the areas with betadine scrub daily and apply zinc oxide paste to affected area to help protect it. There are some alternative and new treatments being developed, and also for those that don't respond well to conventional treatments. Some of the alternative ones are acupuncture. For allergies, either immunotherapy or immunosuppression, which respectively either desensitize the horse to or prevent the horse from reacting to harmless plants, etc. in its environment. And then a product that's been being developed for the last 10 or so years out of a place in Florida is called Silver Winnie's Socks for Horses. They're essentially leggings for horses, but what makes them effective with this sort of condition is that they have silver thread woven throughout them, which helps keep bacteria and such out. And they are breathable, but also provide a barrier. So they allow airflow, but still keep dirt and other contaminants out, so that the legs can heal. Chronic progressive lymphedema, or CPL, is one of those conditions, one of the underlying conditions, that doesn't respond very well to conventional treatments. So a few new ones have been developed so far, one of which is a horse jacuzzi, which keeps the horse's legs clean, but disinfected and massaged, helps them heal more quickly. Now, there are some medications that help, but they don't solve the problem, but are cost-effective palliative care. Bottom line, Dr. Anthony Yu of Guelph Veterinary Dermatology Practice in Ontario states that although topical treatments are labor-intensive, they are currently the most effective and economical method of delivery to the superficial lesions. Complications of EPD. Several of them. Secondary bacterial infections, granulation tissue or proud flesh. This is particularly common once it reaches the grapes stage. Chronic infection, which is like one step past grapes. So it's chronic skin thickening causing fissures from constant movement and flexion. And also ulcers and swollen limbs from the edema. Prognosis. The earlier the diagnosis, the better the prognosis, like with many diseases. Usually, when caught early enough, EPD responds well and completely to treatment. But if prevention measures are not implemented fully and completely, predisposed horses can suffer recurrences. So, to prevent those recurrences, don't pasture horses in wet or muddy conditions. Make sure that when they're stabled, they're in clean, dry conditions. Don't turn them out until the ground is dry, and that includes waiting for morning dew to evaporate. Check their legs every time their feet are picked out. This allows for early detection and therefore early treatment. Keep the long hair on their fetlocks or full feathering trimmed up. Clean their legs after exercise, particularly if using neoprene boots. If you're going to be traveling over very abrasive surfaces or working on very abrasive surfaces, make sure to wrap their legs. And this may just be region specific, but at least around here, you want to monitor irrigation closely to prevent pastures from becoming saturated. So, what's the big deal? Why do we need to even know about this? Equine Pastern dermatitis has many different causes, and if it's not treated, it can progress to severe lameness and other serious issues. It's extremely common, and the horse owner needs to know how and why it happens and how to prevent it, particularly for working or performance horses, because it can put a dent in their careers or their ability to work, which is especially important around here where you have a lot of working ranches. Fun fact, sauerkraut is a very effective treatment, at least in some cases, depending on what the underlying condition is, and if applied correctly, can actually clear up the condition in a matter of a few days. So what you do is you take a handful of sauerkraut and you put it on the pastern, whatever the affected area is, put it on, put a sock over it, and bandage it. And you leave it. And usually, at least the horses I know that the owner does this with, horses there are turned out 24/7, so it takes about 2 days or so until the sock falls off, and she said that every single time, I quote, it works every time. So it's helpful, and it can help really accelerate the healing process. So if it's not completely, entirely healed by the time it falls off, it's going to be close to it. And the reason this works is because of the acidity in the sauerkraut, whether it's store-bought or homemade. Either way, the vinegar in the store-bought will do the same thing as the fermentation process of homemade. And it's that acidity that helps heal it. And my works cited.